Good afternoon. I am presenting a case of toxic anterior segment syndrome following Ipcl implantation in a myopic eye. Toxic anterior segment syndrome is a rare condition characterized by postoperative inflammation after uneventful anterior segment surgery that occurs within the first 12 to 48 hours after surgery. Several etiologies including retained lens material, viscosurgical devices, glove talc, intracameral antibiotics and endotoxin contamination of balanced salt solution have been identified. So coming to the case report, this was a 27-year-old male patient who underwent Ipcl implantation in left eye for high myopia. He presented with complaints of diminution of vision, redness and mild pain 4 days following surgery. Surgery was uneventful and patient had vision of 20/30 on postoperative day 1. Ocular examination, on the examination visual acuity was 20/600 and anterior segment examination under slit lamp biomicroscopy showed corneal edema with anterior chamber cells and flare, dilated pupil with pupillary membrane and hypopyon. Intraocular pressure was elevated on applanation tonometry and B-scan ultrasonography showed moderate echoes suggestive of inflammation. Patient was started on topical antibiotics and anti-glaucoma medications. He was given intravitreal antibiotic 1 dose, that is vancomycin with ceftazidime, under topical anesthesia, and AC tap was done in the same sitting. The AC tap did not show any microorganisms in gram stain and in culture after 48 hours. So following this, the patient was started on topical and oral steroids along with the topical antibiotics and anti-glaucoma medications. So this was the post-operative day 1 following IVIB injection after starting the steroids, and this is the post-operative day 3. You can see the decrease in the edema and the inflammation. On follow-up, the corneal edema reduced, the anterior chamber reaction decreased along with the intraocular pressure. B-scan ultrasonography also showed resolution of the echoes and the vision improved to 20/30. So in 2014, Gomez, Baster et al. Retrospectively reviewed 349 eyes of 216 patients with ICL implantation, reporting low incidences of postoperative complications with only one eye presenting with Tass. Few reports of Tass after phakic IOL have been published. Most of them are from anterior chamber phakic IOL cases and only one case reported following ICL. So these are the various causes noticed by Bodnar Z et al. There are different causes causing Tass, like inadequate flushing of the cannulator instruments, use of reusable cannulas, inadequate manual cleaning of instruments, touching of the IOL or patient contact areas of instruments with gloved hands, etc. So in conclusion, Tass is a rare complication after phakic IOL implantation. Early diagnosis and management is essential to prevent long-term sequelae. The most important step is prevention with adequate intraoperative manipulation of the ICL, surgical instruments and intracameral fluids. These are my references.